Here's a harsh reality check. Robert F. Kennedy Jr.'s new MAHA report might just be the final nail in the coffin for those who believed he could revolutionize healthcare. But here's where it gets controversial. While many hoped his anti-vaccine stance would be balanced by progressive reforms for chronic diseases, the report reveals a starkly different agenda. If you've been holding out hope that Kennedy could improve the system, it's time to take a hard look at what he's actually proposing. When President Donald Trump appointed Kennedy as Health and Human Services Secretary, the move sparked a mix of cautious optimism and outright alarm. Politicians from both sides of the aisle and respected medical professionals tried to find a silver lining, suggesting that any harm to vaccine standards might be offset by his promised focus on chronic illnesses. And this is the part most people miss. Kennedy's plan, as outlined in the MAHA report, doesn't just ignore critical public health measures, it actively undermines them, leaving many to wonder if his reforms are more about ideology than actual healthcare improvement. Take, for example, his recent collaboration with Linda McMahon on mental health for children, where they advocate for natural sources of treatment. While the idea of holistic approaches isn't inherently problematic, it raises questions about the role of evidence-based medicine in his broader vision. Is this a step forward or a dangerous detour? The report's emphasis on alternative methods over proven scientific practices has left many experts scratching their heads. What's truly ironic is how Kennedy's plan seems to prioritize fringe theories over the very real, pressing issues facing healthcare today. Chronic diseases, mental health, and vaccine hesitancy are complex problems that demand nuanced solutions, not sweeping, unproven ideas. Here's the million-dollar question. Can Kennedy's approach actually work, or is it a recipe for disaster? As you digest the details of the MAHA report, consider this. Are we witnessing a bold attempt to rethink healthcare, or a misguided experiment that could set us back years? The stakes are high, and the debate is far from over. What's your take? Do you think Kennedy's plan has merit, or is it a dangerous gamble? Let's hear your thoughts in the comments. This is one conversation that needs more voices.